esto a Concussion Podcast. Mi nombre es Nick Mercer. Este es episodio 71. Welcome to Concussion Talk Podcast. My name is Nick Mercer. This is episode 71. And I'm talking to Alejandra Merriman and Oscar Lopez-Huerta, who are makeup Latinx ATs, Latinx athletic trainers. Concussion Talk Podcast is presented by HeadCheck Health. HeadCheck Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Track Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more. So, Oscar and Alejandra, can you please introduce yourselves? Por favor, presentaces. Presentaces? Is that right?
Yes.
Presentarse.
Presentace.
That's fine.
Okay.
Go ahead, Alejandra.
My name is Alejandra Merriman. I am a secondary school athletic trainer in Los Angeles. I'm going on it's about to be 10 years certified as an athletic trainer. And we're here today to talk to you guys about barriers in concussion for the Latinx population.
And my name is Oscar Lopez-Huerta. I recently graduated from UNLV, and I'm going to be starting a new position at UNLV this week. And yes, like Alejandro just mentioned, we will be discussing the intricacies, you could say, of the Latinx community in regards to concussions and everything else that concerns healthcare.
So, ¿cuál es Latinx? What is Latinx? And that's my end of my Spanish attempts, because I think you guys will discuss you guys with you with my Latin, with my Spanish. See, it said Latin there in Spanish. But anyway, so what is Latinx?
It's un comunidad. It's a community. Our mission is to represent the Latinx community. We aim to foster engagement of ethnically rooted multicultural students and professionals to provide, a good quality of care to all of our patients, but more specifically to serve our patients in the Latinx community. And so it's more about making sure that our Spanish-speaking patients and our Latinx athletic trainers are both very well represented.
Yeah, and we have, with everything going on in the States, there's been a lot of discussion of identity, whether it's cultural, ethnic, racial backgrounds. And this organization is an all-inclusive and a diverse organization. But as Alejandro mentioned, one of our main goals is to highlight the Latinx community within athletic training, to empower us so that the voice can be heard. But in the end, it's to educate everybody, to include everybody in the conversation. Because just because you don't necessarily look like you're of Latinx descent, maybe you do identify based on your family history. And now you have a space to say, I do belong here, and you are comfortable in your own skin. And that is something that we want to provide for everybody.
So just as background for me, I'll see what is Latinx as compared to North American, well, Central American and South American. Just what is Latinx?
So Latinx is being inclusive to Mexico, Central America, South America, and the Caribbean.
Okay.
The term Hispanic excludes Brazil, and so Latinx, the X in Latinx is being friendly and respectful to our LGBTQ plus community. It's gender neutral, so it doesn't assign a gender to the patient or the person. But Latin America, being a Latino or Latina, means that you can be from Mexico, from Brazil, from Costa Rica, Cuba, Dominican Republic. So it encases all of the Latin American countries.
Okay. And I can't see Oscar, so like.
You're
saying something.
Yeah. Just to follow up on what she's saying, the X is, of course, to be all inclusive regardless of how you identify, and it kind of rolls off the tongue a little easier too. because within
Right.
especially the Romance languages,
Yeah.
what there's a lot of gendered verbs and nouns,
Yeah.
right? So we're limiting uh, that kind of sentiment. So that way, it's just all inclusive, and there's no gender identification. It's just the word, and that's it. And some people, there have been backlash and everything in regards to the use of the word, but we use it in that regardless of what you and who you are, you do belong in this community.
So I want to ask you about obviously about concussion, but did you first want to talk about some of the, or did you want to integrate that into your discussion of concussion and athletic trainers' role in that in diagnosis and treatment, or did you talk about barriers to the Latinx community? Or just is there one issue you'd like to discuss right away, or would you like to integrate that more into what we're going to talk about concussion wise?
Well, we can dive into our role. I'd love that.
Okay.
I think as athletic trainers, especially in the secondary school setting, middle school and high school, we are the first responders. We're the first
Yeah.
patient action, and we are very well versed in concussion treatment. I'm not going to say diagnosis because an official diagnosis comes from a physician.
Right.
Um, we are very well versed in recognizing the signs and the symptoms and how to take our student athletes not only through a return to play protocol, but a return to learn protocol in the secondary school setting. But even outside of high school, in the collegiate level, mostly all colleges do have an athletic training staff. And so, as in high school, we are the first line of defense when it comes to healthcare. And so, it's definitely something that we are used to dealing with as part of our as our healthcare.
Great. And so, sorry to ask you just else that, or I
No,
can't.
she
It's
said
hard
it
to.
perfectly.
Okay. I was gonna say because it's a good time actually. If both of you would like to do it, maybe one of you play do a bit of role of an injured athlete, and the other one could be the athletic trainer, and what kind of the athlete would have to say a suspected concussion. So how would you approach this player if say Oscar you were the athlete and Alejandra you would came onto the field to assess this injured athlete who you suspect having a concussion?
Mm-hmm.
Yeah, go ahead, Alejandra.
I would ask the athlete, ¿Cómo te sientes? How are you feeling? ¿Te sientes bien? Do you feel okay? Do you feel good? And then I would go into asking, specific signs and symptoms questions like, ¿Tienes dolor o presión en la cabeza? So do you have a headache or pressure in your head? ¿Tienes náusea? Are you nauseous? Or sientes como quieres vomitar? So do you feel like you need to throw up? During my evaluation, I would ask if they would see double. So if si tienen visión doble o borrosa or blurry. I would ask them if the light or the sound bothers them, si le molesta el ruido o la luz, si se sienten confusado or, if they're confused, if they have difficulty concentrating, si se sienten bien, if they feel normal, if they feel out of it. So those are the questions that I would, start to ask my Spanish speaking patient in the initial evaluation. And then I think the concern comes more so when parents are involved. I'm trying to
Right.
communicate with them in that case. But that's generally how the typical questions I would ask off bat
Okay.
when approaching a
And
student athlete.
and Oscar, how would you if you were say did not speak English well, which you
Mhm.
obviously you're born in Las Vegas, so similar to English is not a problem, hasn't been a problem so far. So,
Right.
um, how would you if you what sorry, well, I'll answer a broader question. And I'll ask Oscar first. Have you noticed? What questions have you noticed cause problems for people who are not fluent in English? What types of
Yeah,
questions, or all
it
around of people aren't say didn't know Spanish very well, but that's probably not so much a problem in the States.
Yeah, so I've actually been able to help out at a tournament once. It was, I believe, a soccer tournament. Actually, I did a basketball tournament as well, where I was talking to a patient who only spoke Spanish in both instances, and
Okay.
and one of the patients came from Mexico, so just Spanish, right? And
Yeah.
what I kind of got from them is they do understand English, they do know what we're talking about,
Yeah.
but it's
But they can
sometimes,
express well.
yeah, yes, in both. And sometimes what I've noticed is the pressure to answer the question immediately, right? You have a
Right.
couple
Yeah.
of people surrounding you, and although you might have a bit of knowledge in regards to English,
Yeah.
you have all these people surrounding you, kind of questioning you, taking
Mm.
all these measurements, whether it's heart rate, blood pressure, temperature in certain cases. So sometimes it's not even the language barrier that's an issue for some of these, because the younger kids, they tend to learn English because they
Mm.
have to, or
Okay.
because of the schooling. Um, Sometimes it's more of like, well, I'm in an unfamiliar area with people that don't look like me and maybe don't speak the the language that I speak predominantly, which is Spanish. So I've noticed that when I was in that vicinity, right, they always, kind of stood next to me. They were talking to me more, and I would be somewhat of an interpreter between
Mm.
myself and the other staff. So it's understanding that, well, certain words can translate better than others. So head and cabeza are two completely different words, but respirar, that's to breathe,
Yeah.
respiration.
Yeah.
It's exactly. So finding those similarities in language helps a lot, because you can get maybe an idea across. My medical terminology in Spanish isn't the strongest because I haven't worked with a huge Spanish speaking population, but I do know that many of those words translate, right? So I do my best in those instances to, okay, if I ask, have you taken English before? Do you understand? So, hablas un poco de inglés, ¿me entiendes? When I speak English, I would do a bit of the switch to see if they would pick up on what I'm saying.
Mm.
If they feel comfortable enough, then I could proceed with my evaluation. And in
Right.
regards to the fully speaking Spanish individual, I would ideally get help from coaches. If there's a parent involved or a guardian that may know a bit more English than the patient does, I can relate some of the information I gain from both of them, right, to my staff. So utilizing as many people as possible to not only keep the patient calm and confident, but also makes my job a little easier.
Of course. In the 100, you would you've also you've experienced a different range of athletes and ages, and so how do you what have you found of because you high school athletes or who you treat now as now I don't know when you're past, but you who you have treated, or do you
Hmm.
find you find that there's a big problem with not a big problem, are there any problems with translation in the in the Spanish speaking context, or with the
Um,
parents?
well, with the parents, it's more getting them to understand. It's difficult. Let's just say you have a broken bone, right? I have an athlete who I suspect has a fracture. A fracture you can see on an X-ray, and if there's a deformity, you can physically see the deformity, right? So a parent would
Yeah.
be more understanding as to why they need to take their son or daughter to the hospital.
Mm-hmm.
But with a concussion, concussions are more invisible. You can't see a
Very
concussion on
true.
a
Yeah.
scan, you can't see it on an MRI. It's not going to show up on an X-ray. So for a parent to understand, more so a Latinx parent, because of culture and the way that the community is with going to the doctor, typically a Latinx patient will wait to go to see someone unless it's an absolute emergency. And that just has to do with, health literacy and trust and education. And so it's that part I find most difficult is trying to get the parent understand with a concussion, like, although they seem fine, in
Yes.
the next 72 hours, things can drastically change, and they can change very quickly or they can change very slowly. And so it's just more so trying to communicate in Spanish what exactly a concussion is. Because, like Oscar said, medical Spanish is completely different. And the average Spanish-speaking person is not going to know a lot of medical Spanish. They may not know what a conmoción is or a concussion or what happens, a lesión in the brain. They may not understand that. So it's trying to find the correct words to describe the severity of the situation, but not so much where you're scaring the parent, you know?
Right, yes.
So
And sorry, go ahead.
no, I was going to say it's typically easier for me to communicate with a child, with the actual student athlete.
Yeah, right.
It is trying to get the parent or guardian to understand the severity of the situation.
Because I was reading through your Instagram accounts, Latinx Instagram, at Latinx ATS, and I noticed you had a bunch of whole slew of photos that were medical terminology, Spanish English medical terminology. So, what do you find? What inspired you to do this? And it was just what you said, obviously, but it inspired you to. And what have you found? Have you found has it been very as beneficial as you had hoped?
Well, if I could touch on this really briefly, for me as a recent graduate of an athletic training program, it fills a void with a lot of information. So we've in my area specifically, Las Vegas is a very diverse city with a large Latinx population. So you're gonna have athletes that speak Spanish, right, regardless of where they come from.
Yeah.
So, and even at the high school level, and that's where a lot of the ATs in Nevada are at this moment. So, with this information that we have produced, it fills that void of, okay, how can I talk to a parent? I might not be great in Spanish, but maybe I could get at least a handout or a little bit of like make a poster out of it. So this is what this content is for. It's to pick up certain terms, maybe get familiar with Spanish again if you took it in high school or in college, to get a couple phrases down. But then you're able to communicate. Okay, so this is exactly where the fracture is. Fractura en el pie. You have a fracture in your foot. Oh, okay. Now I understand. The parent or the athlete understands. And this, down the line could be implemented in different educational programs, just because there's a lot of people that speak a variety of languages in the States. And with Spanish being one of the more common languages, it only will make sense to include this kind of information into medical education. That way you're accessible to all your patients, not just to a limited demographic.
Right. I think that I'll probably say this word 1,000 times, like just healthcare literacy, just the understanding and the knowledge and having those resources available for your Spanish speaking patients is huge. In our culture, we are more understanding when a healthcare professional spends that time one-on-one with us instead of just, bedside manner. We are more likely to trust you if you take that time to build a relationship and to understand and explain things. If you give someone resources, they are more likely to follow up because they have things to read and educate themselves on. And so, as a Spanish-speaking athletic trainer, my concern wasn't my student athletes. My concern were the Spanish-speaking student athletes who were being treated by a non-Spanish-speaking athletic trainer. How are they communicating? Are they getting over those barriers? Are they communicating well? Are they building those relationships with the parents in the community? Do they know how to communicate? And so to me, making this series, the medical terminology series and patient care, Spanish speaking patient, was more so for our community of athletic training, the non-Spanish speaking athletic trainers, to be able to utilize these. We have all these social media posts available as infographics. And a lot of our athletic trainers have expressed to us how grateful they are for them. They've printed them out, they've laminated them, they have them in their facilities, and it's helped them to better communicate with their student athletes. And that's one of our sole purposes, is to make sure that our Spanish-speaking population or Latinx student athletes are being well represented, and to be well represented, you need to know how to communicate with them in some kind of manner. I'm not asking anybody to have a whole conversation with an athlete or a parent. Like Oscar said, just knowing the basic words to describe pain, that's really important, because oftentimes when you're having a conversation with somebody in Spanish, when they don't know English, you say one word and they'll just shake their head and agree, but it's trying to really pinpoint and use as many different words as possible that they don't understand, so you can actually get the correct and most accurate information.
And actually, Alejandra, you're good with that because you have a lot more experience in approaching athletes who are injured. Have you ever approached one with, not an injured athlete, with say English speaking athletic trainer who didn't, who's asking a question and say, like, how are you okay as does this hurt, and they said something and the athlete would say Spanish and they couldn't, there was lost in translation there or in between. Say
Absolutely.
the athlete who said, "Oh yeah, my knee hurts," or my head throbs, or whatever, and the athletic trainer doesn't the word throb in Spanish would know what that means or whatever. So sorry.
Absolutely. More so, I used to right out of school. After I passed my boards, I worked in a PT clinic. So I saw this more so in the PT clinic, because I am
Okay.
Spanish speaking. I
Right.
got a lot of Spanish speaking patients,
Yes.
and I saw a lot lost in translation between the English speaking physical therapist and the Spanish speaking patient, and more so in the older population. The older Latinx people would they're there they just do what they're told, if that makes sense. Like, well, my doctor said I need to do this, so I'm here. And that the trying to describe that terminology, if they don't speak English, if someone says dolor
Okay, to the degree like the mucho, like that's all English knows, to mucho pain.
right.
Like it's
I think pain is one of the biggest issues with knowing how to describe pain, because
yeah.
there's so many words to describe the type of pain. And not all clinicians know those words. They only know maybe one or two of those words. So it's making sure that you're not losing that type of translation when you're communicating with the Spanish patient, because again, like through cultural competency, the patient will more than likely just agree, or like if there's someone there, they'll be like, oh, just give them all the information and they'll tell me everything. But then they usually, that usually never ends up happening.
Oh, exactly. Yeah, yeah. So what what's the word for because important for actually writing the question. I said, have you ever given before you've gone to say national or statewide tournament or
Having you're really staticky. I don't know if
oh,
it's just on my end, but I
hopefully it's not. Hopefully it's not. Officer, can you hear me?
Yeah, it's also a little bit staticky, but it's
Oh,
getting a little better now. Um, but just to continue off of what Alejandra just mentioned, um, the handing off the information to a secondary person, whether it's like a friend or a guardian, older brother, then that kind of weight falls on them, right? And if they don't have the strongest English speaking ability, then there's also another conflict because then they can't even relay the information to the patient themselves.
mm-hmm.
So then you get more muddled information, and then the effectiveness of your potential treatment decreases because you can't communicate properly. So when I was reading that certain athletic trainers had these laminated and all over their rooms, I'm just like, well, this is great because not only are you showing that you're accessible, but you're also enhancing everybody around you, right? You might have other patients coming in asking questions and potentially picking things up and being able to communicate with their teammates. So let's just say
yeah.
if in the collegiate setting you have a variety of international students, right? So if one of them doesn't come in as often for whatever reason, maybe that particular athlete who read some of the information on the infographics could be like, hey, I'm learning, like let's figure things out. So now you're more accessible through a different means, right? Through a comfortable secondary person, right? Which would be that teammate. So then you're just more effective in that regard because now you have two people who kind of understand Spanish, and the second person being the Spanish speaking athlete in question is like, okay, now I got two people who know Spanish a bit more than I thought they did. Now I feel more comfortable opening up about minor things that I pick up during practice. Maybe I didn't feel good this morning. I can go in and see this person instead of being turned away, because sometimes, and unfortunately this happens, to where because somebody else that speaks Spanish, like, I don't feel super comfortable. My other staff will be here later today. Can you come in later? Later comes, that athlete doesn't come in. So now you're more accessible at all times because you have that information around you. And that is just a welcoming kind of environment at the same time.
Right, right. And if you were to have, say, one of those laminated pieces of like posters with different terms on it, or different, say, definitions of for if a Spanish-speaking athlete came into a room, to a training room, or an office, whatever you call it, and they were had issues with their knee or their head, their head for us. What terms would you like to have on that sheet of paper so they'd say, I feel like this is what I mean. I feel like this describes me. This is better definition or description of my pain and what I'm feeling. Because what terms would you like to have if I'm making any sense at all?
Yeah.
Would you like to have on a sheet of paper that they can point to and say, that's me. That's what's going on in my head.
I think in the secondary school specifically,
Yeah.
We don't have the typical evaluation form that you would find, let's say, like at a Kaiser, where you can circle body parts. But I do think if you could have that and have it accessible for your athlete to maybe circle where their pain is, and then I think those adjectives are really important with pain. Like aching, adolorido. Is it agonizing pain? Is it annoying pain? Is it molesto? Is it burning?
What does molesto mean?
It's really bothering you, annoying you.
Okay.
Having those specific terms to describe pains would be really helpful, because typically the type of pain can help lead us towards what the actual issue is and where it's coming from. But I definitely think if you can find or have some kind of evaluation form where, I don't know if you know what I'm talking about, they have the actual body where it says like circle where you're feeling pain today.
Yeah.
Like that, I think that would be better, because again, like radiating pain, but they're not going to know that the pain might be radiating from something else. So having something like that, a tool where they can physically write and see where their pain is. I also have a lot of anatomical charts in my athletic training facility.
Right. Yeah.
So when I'm explaining things, they can physically see it and understand a little better when I'm trying to communicate what exactly is going on with them.
And to go off of what Alejandra just mentioned, we have one of our posts in regards to the medical terminology. One of the last few slides, it shows like a pain scale with the faces. Showing the difference.
That's what I was going to mention that.
So it has both an English version and a Spanish version, right? So that for a younger population who might not fully understand medical terminology in general, can take a look at that, like, ¿cómo te sientes? How are you feeling?
Yeah.
And they look at that and they point to it. They don't have to.
And there's
there
are like 8 faces or something like that, and there's like frowning and smiling and flat face and like that. Is that what you mean?
Yes, exactly.
Okay.
And because that's something universal. Body language is universal. So you see an athlete coming in, and you could tell based on their gait, based on how they're holding themselves. Okay, I have an idea, right? And now with this kind of infographic, then they can tell you without using, the limited English, right? Because even then, you might feel uncomfortable trying to talk to somebody who is a medical professional who clearly knows English, and you as the patient, you may not know a whole lot of English. You are therefore in your head could be deemed inferior. So you're more hesitant to speak up, to talk. But when you do, and I've noticed this, when you see somebody that, can speak Spanish, regardless of what they look like, it's like, oh, okay, I feel comfortable enough to go up. And now I can do my best to communicate. And having these little things just welcomes that conversation to happen. Really briefly, I once had an opportunity to speak with a parent whose child suffered a concussion. We told the kid exactly what was going on because he understood English. Mom comes in afterwards, concerned about her son, and I was the only person at the time who spoke Spanish. So, I stepped up with my poor medical Spanish, but I was able to communicate exactly what needed to be done post concussion, right? Rest, adequate rest, checking in every now and then to see how they're doing. If they do increase in symptoms, right? Si se sienten peor, so they get worse, you have to go to the doctor. And like she asked questions too. So I was able to connect, the medical side with Spanish, and she was comfortable enough to be like, what can I do for my son? So if I had the infographics available, you best believe it would have been much smoother, right? But that's why this kind of content is so important, because that conversation with a mom could have changed everything for that kid down the line. You know what I mean?
Yeah. And actually, sorry, go ahead, Alejandra.
I was just gonna say building that relationship is really important. I think in the Latinx community, especially with the parents and the older population, having someone being able to understand and communicate on a personal level creates such an increase in trust. And oftentimes too much, where they depend on you a little bit more, but that's what you want, because if there's not that trust, then that care is going to get lost, and your athlete is not going to get the proper quality of care. So even if you are a non-Spanish speaking healthcare professional, just trying and knowing a few words and trying to communicate in their language already shows that person the inclusivity and the fact that you're willing to try, and it builds that trust for even more.
And that actually leads one on my next question. I don't know, Alejandro, I'm not sure where you did your degree, but Oscar did his in Las Vegas, and and you did yours. Sorry, I
in
don't
Los
want to.
Angeles. I did. I went to Loyola Marymount University in Westchester, California, and I
Okay, so cool. Great, two different schools, so that works out well for me actually. How did you? How were the say? How were you taught? Because I mean, I assume we're both taught in English, and was there much difficulty when you learned about, say, for this matter, this podcast, learned about concussions, how to treat concussions? How did you? Was there much difficulty not for if in knowing what the proper medical terms were in Spanish for as athletic trainers, not as athletes,
no,
but as
there was in terms of undergraduate degree in school, there's not really anything taught in a different language other than English.
Yeah.
So being when I went from the PT clinic to my high school where I'm at now, I literally relied on Google and Amazon and bought a few textbooks to help me with my my medical Spanish. I use a lot of the CDC documents. They have a lot of the heads up stuff in Spanish.
Okay.
But even that language is really advanced if if you go back to thinking about the social determinants of health and the lack of education. Typically first generation students have either parents or immigrants, so who knows what education they've completed if they're able to understand these words on paper. So in terms of my undergraduate education, I was taught and educated on concussions, but it wasn't until I started doing my own research in Spanish and translating my own things in Spanish did I learn medical terminology. And I'm very thankful for my time I spent in the PT clinic, because having being one of the few Spanish speaking athletic trainers there, or just staff, because most of our staff in the front spoke Spanish, but in terms of like actual healthcare professionals, I was maybe one of two or three that actually spoke it fluently. So that really forced me to brush up my skills in medical Spanish, and it forced me to look things up on my own. And
there's no help from the university. Nothing at university. That was like not necessarily. I shouldn't say no help, but there was nothing. There was no
not
direct.
in Spanish, not in a different language. Even right now with cultural competency and social determinants of health, like that was not taught in my undergraduate program at all. And so it's things like that which is why we do what we do as an organization, is to provide these resources and to provide this educational information for the athletic training community, because I just graduated in 2011. That's not even 10 years.
Yeah.
And if I get taught that now, imagine the athletic trainer who went to school 20 years ago.
Yeah.
So that's the normal English concussion symptoms and in questions and evaluations, like all of that stuff is taught. But in terms of, learning how to communicate with other patients who don't speak English, that wasn't really versed upon,
even in California, which is very
right.
multicultural and very a lot of Spanish speakers in California. You'd think they would have some sort of
not an athletic training per se. I'm sure in other healthcare professions, like if you're a physician, they'll definitely touch more upon that. But in athletic training specifically for my undergraduate program, learning how to communicate in Spanish was not taught at all.
And Oscar, you said you just graduated, so how's there any improvement in Nevada, in UNLV, in Spanish medical terms, Spanish medical terminology for you rather like training?
Yeah, so within the program, unfortunately, there wasn't a whole lot of it. If there was, it was like a paragraph in a textbook and perhaps an article or two. But since I recently graduated, I've noticed that a lot of the student organizations and a lot of just the student body in general take the initiative to do these kind of things. So many put on like a workshop. UNLV actually did have a class or two in regards to medical terminology in Spanish. And this was, I think, in February. I'm not too sure. I don't remember too well. But there was a course. It was like a couple of weeks long, and there was two levels: an intermediate, like you were relatively fluent in Spanish, or a beginner level, to where you knew a little bit, but you wanted to just brush up and get more familiar with the medical terms based on your profession. So that showed that they understand that there's a need for that, because there might be a ton of Spanish speakers wherever, California, here in Vegas, but there's not a whole lot of Spanish speakers that are in healthcare professions, right? So for those who are in those kinds of professions and they don't know Spanish, well, that was what the purpose of the class was. It's like, we need more people to communicate with our patients. So let's put on a couple workshop classes so that way you can get familiarized with the content. But as Alejandra said, even these past 10 years, there hasn't been a whole lot of shift in regards to inclusivity in language. So it's up to us students to kind of put on these things. I do know that a lot of the students in the current program at UNLV are of Latinx descent. They identify as that. So they might want to do something like that, since Latinx ATC is now an organization. There's a possibility to where they could take inspiration from what we're doing and they could try it their own way. The UNLV Student Medical Association, I'm aware that they have a diverse background as far as who's in charge of the organization. And I know that there's different, like the UNLV Social Justice Office, they also put on different workshops for Spanish speakers and sometimes of other cultures as well. So it's going to start slowly changing. It starts with the students seeing that there's a need, and then eventually it'll go up to the faculty and staff understanding that this has to be implemented into the education. And hopefully it goes to the top, to the KD and things like that, so that way they're aware of what's really going on, who we're really talking to in our training rooms and on the field,
Great. Actually, well, for the land into a last, let's do a two-part question, really. But first of all, thank you guys so much for being here. It's not really a question, but statement. So thank you so much, and gracias por todos. And that's my best attempt. And so if you just tell everybody where you can find Latinx and where you learn more about it, or just anything more about it you'd like to say about it. And also, actually, before we sign out and this podcast, if one of you could be the athletic therapist to explain to the other parent, act as a parent, is trying to explain to them what their concussed child has, what it means for that your child has suffered a concussion, or what you suspect is a concussion. So, you can pick whichever role you want. Whoever wants to parent and the trainer, but yeah. But so anyway, that's all to you guys now. Thanks so much. Gracias.
Okay. You want to start off with the scenario and then we'll sign off where they can find us?
Yeah, we can do that.
Okay. So I typically, when I'm approaching a parent, I let them know, first of all, your son or daughter están bien, pero, they're fine, but, emphasizing that they seem okay now, but like within the next few days, pueden sentir, and I just start to feel, and I'll just start listing off symptoms, and I try to explain. I ask them if they know what a conmoción or a concussion is. Typically, they'll say no, and so I'll explain. I'll say it's una lesión en el cerebro causada por un golpe o un sacudida. So you cause from a hit or like a shake or something that make them understand that you don't have to necessarily get in the head to receive a concussion, right? And that functionally, funcionamiento normal del cerebro se cambia. So the functionality of the brain, it actually changes because of the, as we know, the metabolic process in the brain and what happens during that whole process. And, from there, I will explain that their son or daughter can experience, X, Y, and Z, and I'll start listing symptoms off. But I really, really emphasize that every concussion is different. I let them know in Spanish que si por ahorita su hijo o hija está bien, pero en la mañana o en la noche, like at night or in the morning, pueden no van a dormir bien, so they're not going to sleep very well. They'll have like disruption in their sleeping pattern, or if they don't have a headache now, si no tienen un dolor de cabeza ahorita, they may develop a headache over time. Also, trying to explain things at home, because in our culture, it's you get home and wash the dishes and make sure you room, and you have to look after your sister, and you have to do this for your grandmother, your grandparents. So it's also communicating with the parent and letting them know, like, hey, your son or daughter really shouldn't be doing X, Y, and Z if their symptoms are this and this and that. And so it's understanding the home culture as well, and communicating with the parent that this, your kid's not milking it. They're not. They really can't do this. They really can't go do that and this. So that's how I would communicate with the parents, and just making sure that they understand the basics of what a concussion is. Again, it's a conmoción cerebral, which I say is a lesión. A lesion is the direct term to the brain, to the cerebrum, and causado por un golpe en la cabeza o en el cuerpo. So a hit to the head or the body that causes the brain to essentially rattle within the skull, and then causing all of these disturbances. So the blurry vision, the headaches, the sensitivity to light, and in the noise and all of that stuff. That's what I would say. Go ahead, Oscar.
And with if the patient is involved, right? If there are high school athlete or even a collegiate athlete, I would speak in both English and Spanish. That way, if the patient is more comfortable with English or understands English, they can then relate the information to their parent a bit more, right? So I can do both as best as possible, but having them both present and being able to talk to them in a way that they would understand, so more in a relaxed kind of tone, because sometimes there is a lot of hesitation when you do speak to a healthcare professional regarding your child's welfare. And because, as Alejandra mentioned, the cultural aspect is huge. So if I understand, like, don't let him like take care of his sister. He has to go to bed. Se tiene que dormir. You gotta wait a few days. Tienes esperar por unos 3 días, unos tantos días before you can go back to play. Antes de que pueda regresar a entrenar, a jugar. And emphasizing that will be like, for the mom or dad, be like, okay, so nothing, right? Like, no puede hacer nada, tiene que descansar. He can't do anything. He has to rest. So then, now hearing it from me, it was like, okay, You, as my son, can't go out. You can't be having fun. You got to rest. No phone, no nothing. And obviously, the kid's like, okay, I understand. But both are present, and I was able to communicate in a way that they understand, not just in language, but in tone, in the way that I kind of just speak in general. That's I found success in that, and it's just because we relate, and I think that helps out a lot. Not everybody can relate to that, but as long as you communicate in a way that they understand, like, okay, we're good. We just got to make sure he's okay. Got to keep him safe. Make sure he eats and drinks water. Perfect. We'll be smooth sailing, and we'll come back if we need to.
Well, cool. Gracias. It was great. And I just want to talk about Latinx and or at Latinx, however you want to, however you would like to people to find you and learn more about your organization, your group organization.
Yeah. Go ahead,
Yeah,
Oscar.
yeah, we have a Twitter. It's at Latinx ATs. ATS is the handle. On there, what we do is we kind of post the same content on both Instagram and Twitter and Facebook. But we also have a link tree to additional documents if it's rather lengthy on either the social media handles. So for the Instagram, it is at Latinx ATs, so ATS, and same goes for Twitter. Right now, we're currently posting a lot of Latinx/Hispanic Heritage Month, highlighting our members and bringing up different facts about the different countries that the Latinx community represents. And down the line, with more time and more planning, we'll have a bunch of other cool opportunities, whether it's maybe fundraisers or maybe another town hall, a variety of things coming up during this fall season.
Yeah, and I just want to emphasize, our community is not just for athletic trainers. We are healthcare professionals, and we serve as part of the sports medicine team. So our content is not just for athletic training. We've had some physical therapists follow us recently. So I highly encourage any and all healthcare professionals to follow us. It's more for our community. It's for our Spanish speaking patients. So like Oscar said, we're on Instagram, we're on Twitter, and we're on Facebook. And we do have a link tree, which is in the bio of our Instagram and our Twitter. And we are currently working on our website. So hopefully that'll be done before the end of the year.
Do you have a website address? Do you know that yet, or
not yet?
Okay.
It'll probably be a Google website, so I'm not too sure yet, but we'll decide that at some point. But we're definitely going to publish the website before the end of the year. And and then our email is also in our Instagram bio.
Great. Well, actually, I just wanted to thank you both, and also say that I checked out your Instagram, at least your Instagram page, and there's a bunch of profiles of your members, and also the invaluable medical terminology sheets you've done, which I think they're great. Those are definitely very informative for anybody who's interested in learning how to converse, at least medically, or at least know terms medically when you or a patient is talking about a concussion or any injury for that matter.
Yeah.
And so I think that's a great feature. And best of luck with all the site and the future and any future events. And Oscar, I hope you can get UNLV can get is how I don't know how UNLV is doing what they're doing right now with pandemic stuff, but if you guys are operational or not, but
Yeah.
hope you can get to start work soon. I said next week.
It's actually this Wednesday. I start my
This
first
Wednesday.
day, so
Oh,
yeah, it's gonna be fun. It's gonna be
good luck.
exciting, and thank you, appreciate it. Muchísimas gracias, Nick.
Muchas gracias. Thank you so much. Gracias.
Gracias.
Bye.
Music at the beginning of this podcast is by Ben Sound. www.bensound.com